I was going to be a dentist. I thought I would be a really cool orthodontist. But then, as synchronicity may have it, my mom was diagnosed with breast cancer when I was in first year of school. And when I came back from Minnesota to New Jersey, I would go to her appointments, and I was really, really put off by the lack of understanding of just basic nutrition. At the time, I wasn't really into nutrition, but basic nutrition. And they were recommending calorically dense foods like cakes or pizza or cookies. For someone I know, just on the basic level, why should you be giving that to someone
Just
with
because
cancer?
they want her to gain weight?
Because they want to. But there's so many other ways to gain weight
Yes.
in a healthier way. And then what happened, it blew me away when the RD came in and she said the same thing.
The registered dietitian?
Yeah, the dietitian. And I was like, oh, no. That sort of set something off within, and within maybe a month, I was out and I was in naturopathic, or registered to go to naturopathic school in a few months. So starting there, it took me on this journey of understanding what I was just saying, treating things as a whole, right? Instead of just seeing, okay, we have a breast tumor, let's remove it. This is the analogy I always give for cancer patients when I talk to them. We have a field and it has weeds, and we could cut the weeds with surgery or burn them with radiation or throw chemicals at it with like chemotherapy. And then at some point, we have our scans and we go, look, everything worked. You look good. Go home and, go back to your life the way you had it. Everything's great. And what happens is nothing changes. The soil doesn't change. We don't even address the field. And unfortunately, for most people, statistically, one weed pops out, two weeds, and then all the weeds come back except more aggressive. They're not responding to any of those tactics. And then there's metastatic cancer. So that is the stuff that blows me away, because that's where we're living in oncology. We just say, scans are good, go home, go back to your life. Still eat like crap. Don't address any mental, emotional trauma. Don't detox, find out what toxins you're exposed to, metals, your home, So it's all these things that need to be addressed. It's so multifactorial when it comes to cancer. So that's sort of where the journey came from.
So tell us what you do, since you've brought it up. Tell us what you do tell a cancer patient who is being released from the hospital and going back to their life.
Yeah, so I tell them this is when the real work starts, right? Because I can help support a cancer patient when they're going through chemotherapy or radiation or surgery. All three can be really grueling. I know everyone at this table knows someone with cancer, or knows someone knows cancer. It's that common. So supporting them when they're going through it, right? So we reduce or minimize the symptoms if and when they come up. But the real work starts after, because after we have to help identify why. Why? Does any oncologist say, let's investigate why you have cancer? No, they say we need to get it out of you. But for me, the body never makes mistakes. The body creates things for particular reasons, far beyond what we understand as doctors or anyone in the healthcare industry. We just don't understand why the body does some things. I believe cancer is created by the body for a particular reason.
So cancer's not a mistake.
I don't believe cancer is a mistake at all.
You've said the tumors are protective.
I believe that.
Can you explain that?
Yeah, because when you have, let's say the example that I saw in a hairdresser who came in with tattoos, neck down, and hairdresser for 10 years, meaning that she's exposed to benzenes, formaldehydes. These are toxins that she's inhaling, touching with her hands, going through her skin. Tattoos, I have a few, but still, they're pretty toxic, especially when it comes to pollutants and heavy metals. I said, let's just test. Let's just look. We tested, and they were through the roof. Everything, even more than I expected.
The
through
metals.
the roof. The metals and the pollutants. The ones that are really identified to be in the hair care industry were through the roof. And I was surprised she didn't have bladder cancer, because it's really tightly wound with bladder cancer, but she had a breast cancer. But what I'm saying is that tumor was holding in and siphoning those toxins from being released into the blood, because her body was overwhelmed to do that. And we saw that because through a detox, when it was too aggressive, that tumor got bigger. But when it was less aggressive and slow and gentle, the tumor got smaller. So that's pretty crazy to see that as straight, direct evidence showing that the body was protecting her with that tumor.
So the more chemicals that she was exposed to, the bigger the tumor got. And
exactly. And here's the thing. We have to understand the way we detox too. Her liver was poor. Her kidney was poor. She wasn't sweating. She wasn't exercising. She wasn't eating well. This is why we have to take a holistic approach to our health, because we have all these awesome routes of detoxification, but Some of us have them closed up, clogged, the windows closed,
Yeah.
and we're not taking care of ourselves, right? And that's through food, that's through exercise. The basics are so important for detoxification, and that's what we saw with her.
Hey, folks. Okay, back by very popular demand is our plant-powered plate fridge magnet, which you are going to receive for free if you leave us a rating and a review on whatever platform you're listening to this podcast on. So here are the details. Just write your quick review. Does not need to be long, does not need to be a whole story. Just be honest and speak from the heart. Then take a quick screenshot of the review you wrote and email it to us at podcast@switchforgood.org. That's podcast@switchforgood.org. And include your mailing address so we can send you a power plate. We are doing this because the more reviews we garner, the higher we go in search results, which means more folks will learn about our podcast. So the power is in your hands. Leave us a review and zoom, your power plate arrives at your doorstep.
So thank you so much for tuning in today. If we helped you in any way, then click the subscribe button and let's keep hanging out together. We have so much more to share with you.
And if you need more information on actually making the switch for good, please visit us at switchforgood.org for loads of info. And you can subscribe to our mailing list where you will receive all sorts of super cool gifts, discount codes to our very fave dairy-free products, and a lifetime of powerful health tips.
So join us on the journey to switch for good. This is the future.